Hi, everybody, and welcome to today's show of We'll Do It Live with Meg Hansen. As you know, I'm doing these daily Facebook live streaming series on weekdays from 6 p.m. to 6:30 p.m. And I'm using my medical expertise, my healthcare policy background to answer questions from you about COVID 19, the pandemic, and specifically the healthcare system in Vermont and how we can be better prepared to face the pandemic. So today's topics are the first one is why is Vermont's COVID 19 case fatality rate the highest in the nation? So this afternoon, I posted a graph on the Facebook page, which I see has been a conversation starter. And well, you can just look at it right on the last post I've done on the campaign Facebook page. And this is what I say. First, I define what is case fatality rate, or CFR for short. This is an important index to measure how severe a disease is. Now, I have to be clear, and I'm going to do a follow-up post after this Facebook live streaming explaining a little more technicalities about what is CFR, and I'm going to now also answer some of the comments. So CFR is not the raw number of deaths. This is a ratio. You know, you have a numerator over a denominator. So the numerator. Let me pull it up so that I make sure that I'm right, and I don't get mixed up. Okay, so here you go. The numerator is the ratio of deaths that are occurring from a particular disease. So in this case, what is the deaths occurring from COVID-19? And the denominator over it is the total number of cases due to this disease. So due to COVID-19, how many people have died over how many people have it. So as you see, it is a proportional measure. It's not a raw number. So let's say New York City has had over 2,000 deaths. We've had 13. So it's not a comparison of that. This is a ratio. So we have to see how many people have it and then how many people have died because of it. And so as you see, it's a good measure to see how severe the disease is. And I think it's more informative than just saying what is the number of new positive coronavirus cases. The media in Vermont, and I've seen some of the national media outlets like to report how many new cases. But as I've discussed before, more than 80% of patients who are diagnosed with coronavirus are able to fully recover and do so at home, and they experience mild to moderate flu-like symptoms. Not flu, it's not the flu, it's different, but flu-like symptoms where you have upper respiratory tract like an infection. So you'll have a runny nose, you'll have fever, you'll feel under the weather. I'm not making light of the severity of any disease. I'm just saying you won't die. More than 80% won't die because of it. And those who are susceptible are the elderly and people with whose immune systems are already compromised because of a chronic disease, whether it's a structural disease in the lung, maybe because you're a smoker, COPD, heart disease, morbid obesity, hypertension, diabetes. So this kind of profile. So that's why saying, oh, now we have 320, 420 new cases, or whatever the number is in Vermont, is not very informative. But a case fatality rate, CFR, as I've explained, how many people have died, in relation to how many people have it, that is a very good measure of severity of a disease. So in the graph that I posted on the Facebook page, which, as I said, has gained a lot of attention. Vermont has the highest CFR in the nation. Highest. It is more than twice that of the national average, which, okay, you can dismiss it. But let's look at other states that are similar to Vermont, and let's do a comparison of that. Let's look at New Hampshire, which has a very similar profile in terms of the population of the age. In fact, the median age of the average New Hampshire, what do they call it? New Hampshire, right? New Hampshirean, Granite Stater. I'll just say Granite Stater. The average median age, of a Granite Stater is higher than that of the median age of a Vermonter. So if you look at that, I mean, but yes, Maine, New Hampshire, and Vermont have the oldest populations in the nation. That's number one. And when you look at population density, which is important because again, when you're making these comparisons, you can't just do a raw number. You have to see how concentrated the living scenario is, especially because we know how contagious this disease is. So when you look at that here in the chart, Missouri has a very similar population density to that of Vermont. Alaska and Nevada have a significantly lower population density. But when you look at the graph, look at their CFR. It's so much lower than that of Vermont. So what explains it? Here I will quote from the Lancet, which is a very prestigious British medical journal. And as I said, I'm going to share this information again on Facebook as a follow-up post following this live streaming. And this is a quote. The CFR can increase in some places if there is a surge of infected patients, which adds to the strain on the healthcare system and overwhelms its medical resources. And that is a point that I've been making with my commentaries, is that our system, the healthcare system in Vermont, is woefully underprepared for this pandemic. We are under-resourced, understaffed, and this is where we are different from the rest of the states. So I've seen in the comments where people are saying, oh, we have a much older population, we have a much smaller population. Sure, but we're not unique in that. There are other states that have a similar profile when it comes to population density and average age of the population. Where I am saying that we are different and we are unique or unusual is that for our particular population, for the age, for the population density, our healthcare system is very, very underprepared, under-resourced. And you know what? If I just want to say one adjective, I would say broken. Broken in a way that really makes us stand out. So it's not one or the other. It's all of it, right? In any complicated situation, it's always a multitude of factors that play into a particular outcome. So yes, we do have a very old population. Yes, we do have a small population. And yes, the outbreaks have been in senior living homes, assisted living facilities in the Chittenden area, Burlington and around that area. Yes, it has been there. That's true. We do have a concentration there of older Vermonters, but there's no reason for Vermont to have by far, such a large margin, the highest CFR in the nation. And so that's why I'm saying the reason is because our healthcare system is broken. And it's broken, number one, because of the regulations that we have. We have very, very severe, unusual, some of the highest burdens in terms of certificate of need and other regulations that are imposed on our healthcare system. We also have a lot of operational constraints that we put on hospitals. We put on insurance companies. We put on insurance. What companies can sell insurance and how, because of our Vermont Health Connect, our Obamacare exchange. We have so many restrictions on every aspect of healthcare. It is so constrained that all of this has tied into or has led to this particular result. That's what I've been writing about. And one very important aspect of that is One Care Vermont and the all-payer experiment that has been going on since 2016. One Care Vermont is a privately managed company, and it runs this all-payer accountable care organization model. It's a model that is designed to remake healthcare in Vermont, completely change the way that healthcare providers, especially doctors, are reimbursed for their services, completely change that, and completely change the way that Vermonters gain access to healthcare. So what the traditional model where you fall ill and you go and see a doctor and then you pay for that service, they see that as the traditional model that is outdated, that is narrow, that is myopic and that's outdated. So here we are pioneering a new system where it's all about a population-based approach. We're going to look at the population as a whole, and we're going to identify the local needs, the health needs, and then we're going to address them using our fancy technology. I'm sorry to put it that way, but yes, that's it. We're going to develop all these new platforms, and then we're going to implement various community efforts, and then we're going to sync them all together, and it's going to be this amazing new first of its kind in the nation program. Yeah, that's not happened. It's not happened at all. Not only has it not brought down the healthcare costs, it's actually increased it. That's its basic stated purpose. It hasn't done that. It's led to rationing of healthcare, and it's led to an overall decrease in the healthy rates of Vermonters. So it's really compromised our collective health, if you want to look at that. Our public health is compromised that because people don't get access, Vermonters, especially older Vermonters, who on average consume more health services, do not get immediate or even, I think acceptable, it's not even an acceptable time frame, access to services. You have to wait months to get an appointment with a doctor. And as we've seen, there's a shortage of physicians. People leave all the time. So what happens when you find out that your provider, your doctor, your physician has left and is no longer in the state? How many months does it take to get another primary care physician? How many months? How many months does it take to get an x-ray, to get an MRI? What is that? That is known as rationing of care, trying to prop up this model, keep the costs down. This is the whole ideological remaking of healthcare in Vermont. And what happens to the patient, really, even if the Vermonter hasn't seen a doctor yet, if he or she is suffering from an ailment, they are a patient. What happens to them over the course of the months where they're just waiting to get treatment? What happens? All these factors are important. They are all going to now, is a ticking time bomb, and I'm concerned. What's going to happen now as the economy remains shut down? I expect it to be shut down in Vermont at least into the summer months. I don't know on the federal level, but this is what months is the word that our leaders have used. So I expect that. And as the economy shuts down, there are going to be real health consequences because of that. And I don't just mean suicide and depression. There are a lot of community, if you want to talk about population-based approach, there are going to be a lot of problems that start coming up when someone is out of a job for months and has absolutely no hope in sight. Well, we don't know when this is going to end. All of these factors are going to play in, and I don't know, frankly, what the end goal is going to look like. I don't know what it's going to look like at the end of this pandemic. So somebody said, scare tactics. These are scare tactics, and I'm fear-mongering, or at least by sharing the graph and saying Vermont has the highest case fatality rate, or by listening to what I'm saying, this is scare tactics. I'm afraid in this case the truth is scary. I'm afraid that's and I think that we should be concerned and we should be scared, because we have to look at the reality of Vermont's healthcare system. We have to look at the fact that our leaders and this massive healthcare bureaucracy that we have, I think it's exemplified best by the Green Mountain Care Board, but also by various departments like Vermont's Department of Healthcare Access. We have an Office of a Healthcare Advocate. Who exactly is that office advocating for? I've never seen any evidence that they're advocating for the well-being of Vermonters. Rather, they're always advocating for propping up one ideological project after another. We have all these various groups, and then of course there's One Care Vermont, and that ties into UVM and the leadership of UVM. We're seeing all these people who have power, and they're holding on to power to serve ideology over individuals. We have to look at that and say they have squandered our public monies, hundreds of millions of our monies, into creating this great, wonderful system that doesn't even work. You would think that in a pandemic, a population-based approach would be wonderful. That technology, that first in the nation technology, and all these efforts would show results. However, and I'll talk about this I'm in the next week. One Care Vermont has just written a letter to the Green Mountain Care Board, and I saw this last night, and so I will study it over the weekend, and I'll get to the facts next on Monday. Vicki Lohner is the CEO of One Care Vermont, and she's written to the Green Mountain Care Board and said, these are unprecedented times. These are very difficult times, so we need your help with more money. We are not able to continue. They want things like extending this deadline for this and all kinds of measures to prop up a $1.42 billion organization, an entity. That's the 2020 budget, which was approved, $1.42 billion. And they should be serving. They should say, hey, look, we've pioneered all these things. Here's all the data that I can give you because of our population-based approach. Here's where we should be focusing our resources because we've identified at-risk people here. Here's where we should be using our technology to reach out to these various communities that are in dire need of help, because that's what they marketed. That's what they said they need our money for. That's what they said. But instead of actually giving any return on the hundreds of millions or now billions that are going into this project, they are saying, sorry, we can't do anything. We need more of your money and we need help. Protect us. This is absolutely, I mean, I don't know what to say. This is shocking. No one's ever experienced anything like this, and this is what we're looking at in Vermont. And I think this is one of the major factors why our CFR is the highest in the nation. Of course, this is a dynamic situation, changing all the time, but don't let anybody tell you otherwise, okay? We are in this really bad position, and things are going to get really bad because our healthcare system is broken. It is absolutely broken. And if you've ever been a consumer of healthcare services, if you've ever had to deal with the bureaucracy, then you know that I'm speaking the truth. And that leads me to my second point, where I didn't know what to call them. I'm seeing that this is a particular group that's taking offense to what I'm saying. So I just call them government apologists for now, because I know they're apologists for something, but what? So I just went with that. As you know, as I've shared here, and I've also posted, about 3 days ago, Vermont Digger published a commentary. That commentary, I'm very grateful for, has also been published on FYIVT.com and True North Reports. And a version of that was published by the Mountain Times, which is based in Killington in Rutland County. So I'm very grateful to have these platforms. But the Vermont Digger one, as you can imagine, their readership is, what is it? It's kind of concentrated in Chittenden County and Montpelier. I think I actually saw a graph once, a digital graph where they look, because it's just a website, right? It's not an actual newspaper. They see where people read, and it's kind of, in that corridor, if you want to call it, sort of the Burlington micropolitan area. And so you can imagine that the responses were critical. Let's just say that they were critical. But then in record time, I've never seen such a, I've never seen this, but in record time, in 2 days, they published another commentary by an individual whose piece attacked mine. And his name is, well, it doesn't matter, but basically this is his article. It says, healthcare in Vermont is limited by the economy and not government regulations. And this individual is a retired physician, and he's practiced medicine in Vermont for 30 years, and so that was that's his claim to authority, and that's the piece that he wrote. So so I found that really interesting. That just in 2 days, here's the rebuttal. But the rebuttal, and I'm going to wade into that a little bit. But so right off the bat, when let's say there's an argument and you want to respond to it. So if the first thing that you do is attack the character of the person who wrote the original piece, that undermines your credibility right away. So by calling me a libertarian, which is a personal first, I mean, no offense to libertarians, but I'm just not one. And I never knew that a libertarian, I didn't know I didn't know that to be an insult. I thought that libertarians had street cred, but I guess I don't know. So he calls me a libertarian. He calls Vermonters for Healthcare Freedom, which is a think tank that I head until recently, which is also not a libertarian think tank, but he calls it that. And he hates on the free market and free market economics. He hates on all of that. So when I saw those things, I'm like, okay, this is a very politically tinged commentary. So I've got to read it with a bucket of salt, right? So, I mean, I welcome criticism. As I said yesterday, I discussed John McClory, the founder of the Ethan Allen Institute. He didn't find my argument about suspending con laws compelling. So, and I welcome that, and I discussed that. So I welcome criticism, and this is something completely unprecedented. So I'm happy to learn and review my conclusions on a daily basis as I'm doing. But if the commentary is politically tinged, you know that, okay, there's a different kind of ulterior motive here. So you've got to take it with a bucket of salt. Okay, but so what he's saying is that regulations have nothing to do with the situation that we are in. He says that I can't blame, this is what he says, quote, I can't blame OneCare nor the Green Mountain Care Board for our state's shortage of healthcare resources. Okay. So in my commentary, oh, by the way, my original commentary that was published by Vermont Digger did not have links. This is a website, so when you write a statement or you have an assertion, you can add a hyperlink. So you click it and then you go to the source, which has the data that backs up your claim. It didn't have that, and so I reached out to the editor, and she's added that in. So I hope that, I hope that's helpful. But I have given data showing that rationing has been taking place under OneCare Vermont. The statistics show it. So he doesn't actually address any of the statistics. He just says, I can't blame them. It has nothing to do with regulations. So I don't know what to say to that, because you have to address the points that I'm making. If you're going to just try to do a character assassination and then put your own views without actually addressing the arguments I'm making, then how is it a rebuttal? I don't understand that. Okay, and then this is an interesting paragraph, quote, if Hansen's concern with Vermont's excessive medical regulation had any truth, our bed situation would be worse than in the rest of the country, end quote. Okay, so bed situation. That's why I'm saying that this is, again, a very, I don't want to say cherry picking, but I mean, really, is the number of beds the right parameter, or is it the case fatality rate? If you want to say that, are we in a worse situation? Are we in a worse situation than anywhere else? Well, why do we have the highest case fatality rate? That definitely, and as I explained at the top of the hour, that the regulations have something to do with that. And again, okay, let me talk about that. So I did say that Vermont has 30 con laws, which is the highest in the nation, and without that, we would have had 6 more beds. So if you just look at beds and you say, oh yeah, by that measure, if all we're looking at is the number of con regulations, then yeah, Vermont has 30. So other places have 0. So our bed situation should be the worst. Except it doesn't work like that, right? There are a multitude of factors. We have a demographic crisis, don't we? I mean, aren't people leaving all the time? I mean, don't we have just about, 520,000 adults? You can't just look at one thing and say that. And I never made that statement that, oh, because of our 30 laws, just because of our 30 con laws, we have less beds. I said the entire picture is one of healthcare rationing. We have been doing healthcare rationing. We have been supporting powerful monopolies concentrated in the Burlington area. And all of these paint a very big picture that leaves Vermont at a serious disadvantage in the face of COVID-19. That's what I'm saying. I'm not saying one factor does it. All of it does it. All of it does it. Yes, of course the economy is bad. But then again, I've said it before, public health and the economy are two sides of the same coin. You can't just say one over the other. It's the same government imposing the same restrictions on the economy with the tax burden and then land use restrictions and their ideological agenda. That's the same one using the same factors with healthcare. So do you see how they're diverting the topic? I never said it's not the economy. But the economy is not what we're considering. We're looking at the healthcare system. We're looking at the foundational blocks of our Vermont healthcare system and why that has left us with serious handicaps. You can't just divert and say, oh, well, look at the economy is bad. Everyone's leaving. That's the problem. So that's one. And then he says, indeed, quote, indeed, it is the free market idea of just-in-time efficiency that has limited our surge capacity in this pandemic. The free market idea of just-in-time efficiency. That's also a brand new idea that I'm encountering for the first time. I'm just going to say this. It's going to be 6:30 in just about a minute, and this might cut off. But I think this is important, so I'll continue doing it. And in that case, I'll come back. So, and I'm still figuring out this technology thing. I'm not a Luddite, as someone else accused me of being one, but okay, so let's get to this. So he's saying a free market idea. Okay, before I go, what the left does, and this is basically the left, and I don't want to be political, but the idea of big government and being a government apologist when it comes to healthcare is on the left in the U.S. political spectrum. So what they always try to say is, you want the U.S. healthcare to be free market. You just want to be a free market. You love free market. You're a free market ideologue. They'll always say that. But here's the thing. The United States healthcare system is not a free market. I've never said that it is, and it is not. So if they say that, you should always say it's not a free market. It hasn't been for decades, and I'm not even arguing that it is. So they're arguing for a point that's not even the truth. So you should just stop them right there. Why is it not a free market? It's not a free market because I don't just go to a doctor and say, okay, here, you know, this was my visit. Great, you gave me the service. Here's the money. What does it cost? Here's the money. And that's it. It's not like that. When you go to a grocery store, it's like that. It's not like that for medicine here. That's not how it's practiced. You have somebody else who covers the cost. That's either a commercial insurance company that you get through your work. That's the vast majority of Americans. It could be Medicare if you're a senior citizen. It could be Medicaid if you are if your income level is under a certain point. It could be the VA if you're a veteran. Basically, it's another payer. It's a third payer, and that's the way that the system is done. So it's not a free market. It's not a free market system. So if he's saying that the free market is why we don't have enough healthcare resources, that makes absolutely no sense. I'm sorry, that makes absolutely no sense. Of all the places, Vermont, the healthcare system in Vermont has nothing to do with a free market. No, it would be like an alien. You know, it would be like comparing, let's say, a human being to a Martian. That's what it is. Like a free market healthcare and Vermont's healthcare. It's like that. We have a politically powerful monopoly in UVM and the healthcare network. We have Vermont Health Connect, the exchange. We have so many restrictions. According to the Mercatus Center, which is not a right-leaning center, a think tank at all, we rank 43rd in the nation when it comes to overall healthcare openness and access. So please, free market has nothing to do with Vermont. Okay. But that's what he's saying. He's saying that this is because of we're not able to deal with it because of free market thinking. Okay. And then he says, and this is, I find this very revealing, quote, "To our national shame, what our system does do is efficiently ration healthcare by ability to pay," end quote. And that's where it is. See, when it's people, and I'm very sorry, but this is something that I'm learning is a pervasive point of view. When you have the world's best healthcare system, which is light years ahead of any other nation, any other Western nation, when you have the best number one healthcare system, and then you call it a national shame, that that tells me that this is a very, very politically motivated piece. Very politically motivated. And what he's saying is that we ration healthcare based on people's ability to pay. So if you have money, you'll get good resources, and if you don't have money, you won't. I'm sorry, but this is a feature of every single nationalized healthcare system, whether it's the UK or Cuba or name any country, whenever you, or Germany for that matter, whenever you have a socialized healthcare system, whether it is single payer, nationalized, whatever version of it, you always get a two-tier system, which means that people with money get access to private hospitals, concierge services, and they're able to get better access, better quality services, whereas everyone else who doesn't have the resources for it gets stuck with the crappy, I'm sorry to say crappy, but crappy healthcare system, which is run by the government. And as there's a clip, I'll be happy to share that again. We've seen that in the United States with the VA, which is a single payer system. The vast majority of veterans don't use it. The only veterans who use it are those who can't afford to go and pay extra to get services elsewhere. So what this individual is doing is accusing the United States of the two-tier system, which is the feature of every socialized healthcare system everywhere. That's what I find really shocking. If of any healthcare system in the world, the United States is the one place where your ability to access healthcare does not depend on whether you can pay for it. However, in Vermont, I'm sure Vermonters are going to disagree with me, because you know why? Because Vermont is becoming more and more and more and more a socialized healthcare system, as you see, because of the ACO all-payer model, the UVM monopoly. And so now when you have long waiting lines, you have to wait for months and months. What do? Now concierge services are popping up, where if you pay a little extra, you can go and see the doctor in 1 week as opposed to 4 months. This is He's accusing. I mean, I don't know. I find it really shocking that this is happening. Okay, and then he's. So I think he sort of knows what he's doing, but then he kind of gives a little. He said, "Okay, well, but," and this is his "well, but" quote. While it is true that the government-regulated single-payer health systems of Europe have also run out of hospital beds, citizens there will not be faced with bankruptcy when discharged from their 3-week-long COVID ICU stays, end quote. Yes. Okay. This is another example of arguing a point that no one's making. No one's making that. Absolutely not. How do you... So are you saying that all the Americans here, the Americans who go to the ICU, will come out and get bankrupt? Really? Why? So he's just assuming. He's assuming that the vast majority of Americans are uninsured. And so... okay, I have to think about this a little more. He's saying that no matter what, they are going to get covered, but everyone here is uninsured. The vast majority, and we're all going to get bankrupt. Really? I like, that's such a... What is the argument that you're making? I don't even understand. I'll tell you this. What's happening when they run out of beds there is that they're rationing ventilators. That's what they're doing in Italy. They're being compelled to do that in Italy. You won't get that here. You won't get rationing here. So the UK has a national health services. It's a nationalized single payer system, and they've said they came up with a new protocol, and they said, I'm sorry, if the number of patients becomes too much, then we're going to start rationing cancer services. So we're just going to look at which patients have the highest rate of survival. Like, we expect this person to survive, so we will give him chemotherapy, and the other people, we're just going to say, sorry, go home and get your affairs in order. is that okay? Is that kind of rationing okay? We don't have rationing like that here. We'll never have that here. But you have that in your single payer health systems in Europe. Is that the point? But he's not, see, he doesn't acknowledge that. He does not acknowledge that. Because bankruptcy is so much more. First of all, it won't happen. That's a false argument. But let's just go with it. Then bankruptcy is so much more, life threatening than being told to go home and die because they're rationing cancer services. Okay. So and then finally he says, quote, I, for one, appreciate our state's efforts at limiting the abuses of unregulated libertarianism. And hope that our country as a whole will begin to see the advantage of health care for all, end quote. And that was the big giveaway. Okay, Medicare for all or single payer or whatever form of it. When in fact the reason why we are in this position where we have the highest CFR is very much because of the excessive regulations that, you know what, that don't bring the healthcare costs down. No, they don't bring it down, but that they prop up failed billion-dollar boondoggles and get favored monopolies rich and also a lion's share of the market. That's what these regulations do. They're not they have brought down the health quality of all Vermonters. They've reduced healthcare access. They've increased healthcare costs. But a few people get to hold on to power and then write op-eds and get published within like a day. So that's kind of what it is. The comments are interesting. It's just kind of the usual people who I've seen really want big government calling all the shots. Now see, there's nothing wrong with, okay, it's not about wrong or right. In some areas, I think that the government has a role. The government has a role in criminal justice, in maintaining law and order, in the military, and keeping us safe. So it's not this hatred that I have for the government. And in fact, I'm running for lieutenant governor, so, I'm running to be a part of the government. I don't have any kind of hatred for that. So this whole libertarian thing is very strange. I don't even think that's the right word. But there is a line. There is a line, a very clear line. There's a very clear line to be drawn in which what the government can and cannot do. And in this case, when you are purposely preventing, let's say, an MRI clinic from popping up, from establishing themselves like a startup, to give a faster access and cheaper access to medical imaging technology to Vermonters, when the regulation stops that to favor UVM's $4,000 bill for the very same technology, just because UVM is failing and they need more money to cover their high overhead costs or pay off their debt. When the government steps in and says, no, we're supporting UVM and we're not going to allow more access, better access, more choices, cheaper choices to Vermonters, that's the problem. So that's the distinction about government or not government. Okay, I'm sort of almost done with this. Yes, and then of course, some people are talking about the fact that the rate of reimbursement to physicians is lower when you have Medicare, but mostly Medicaid. So let's say, if I'm just going to make it very simple numbers. Let's say you go and see a doctor and you have Medicaid and the service costs $100, then the government doesn't give you $100, they'll give you $60. And you have to really spend a lot of time doing paperwork and sort of chasing the government to get that 60. So you have to be in a position to be able to cover that extra 40, which you have to absorb. And some people are or not able to absorb it. And as we've seen an expansion of Medicaid, and this kind of ties into the whole One Care thing, there's sort of a lower reimbursement to doctors. That's also another reason why one of the comments says that's another reason why physicians have left, and so we're seeing a shortage. So okay, I get that sort of related to the discussion. Okay, so I think that this point about oh yeah, and I'm going to end with this. Deregulation is all that the GOP has. That's why all her campaign promises are vague platitudes like, quote, make Vermont a pro-freedom state. How is that okay, well, that's fine. So this also again ties into what this author of this commentary calls me. He said, I have to disagree with Lieutenant Governor candidate Meg Hansen's commentary. So the fact is that many of the critics are saying, okay, this is a Republican and this is a GOP talking point, or and we hate the Republicans and we hate the GOP, or we hate anybody on the right, and so let's attack it. So, and I think that I think that degrades public discourse, frankly speaking, because I didn't write my commentary, and of course these people won't believe it, but I didn't write the commentary because I am a Republican. I wrote it because I have seen the statistics. I've immersed myself in health policy, and I understand how Vermont politics works, having spent years, in the trenches. And I've described my professional expertise at the intersection of health policy and Vermont politics. And so I looked at the facts, and if it was working wonderfully, I would be celebrating it, but it's not. So I mean, the whole point is that I want Vermont to be best prepared for this pandemic. I don't want us to be shut down until September because our healthcare resources and our healthcare system are so threadbare and so broken that you're so afraid that people will fall ill that you're just shutting everything down and letting the economy suffer, as Peter Welch has said that he's willing to do. I don't want that. I want us to be in the best position to deal with this, which is why I'm looking at the facts and I'm sharing it. But if you see that as some kind of GOP thing for deregulation, then I don't know what to say. And as far as making Vermont a pro-freedom state, well, hell yeah, absolutely. I don't see how anybody could have a problem with that unless you inherently have some kind of problem with freedom and the fact that everybody should have freedom for everything to decide how they want to live their lives, what choices they have, whether it's the economy, whether it's how they raise their families, healthcare, education, business, career, life choices, entertainment choices, whatever. I am all for freedom. I am pro freedom. And so, yeah, I'm completely on board with Vermont being a 100% pro freedom state. And so on that note, I'll end today's discussion. As I said, I'll be writing another post answering some of these questions, answering the comments to the graph and sharing some more information. And over this weekend, I'm going to be studying Vicki Lohner, the CEO of One Care Vermont's letter and their latest budget report. I'm going to be studying that closely, and I know it's very complicated. I won't bore you. I'll make it accessible, I promise. I'll break it down, I'll get to the points, I'll make it accessible, and I'll share that with you on Monday at 6 p.m. See you then. Have a great weekend. Stay safe and be well. Thank you.